A very warm welcome to one and all for this Prechop Symposium, and I am very thankful to AIOS and especially Dr. Namrata Sharma Madam for giving me this opportunity to conduct this very Prechop Symposium. I have with me as another Prechop surgeon, a dynamic, prolific, a senior surgeon from Ranaghat, West Bengal, India, Dr. Pradeep Mohanta sir, who will also be a part of the symposium. May I invite Dr. Pradeep Mohanta sir to be on the stage. Since this symposium is for almost an hour, out of which 45 minutes have been given to me and 15 minutes sir is going to talk, I will take this opportunity to start my presentation. I also take this opportunity to welcome my PG teacher, Dr. Professor Khaire sir, who is sitting in this hall, who has recently retired as the Dean of the Government Medical College, Ambejogai. So, very warm welcome, Khaire sir. My inspiration was David F. Chang, whom I had the opportunity to see some of his surgeries and through which I learned the art of horizontal chopping, which ultimately transformed into a pre-chop surgeon. Also, I was inspired very much by this Japanese surgeon. Everybody is knowing him, Takayuki Akahoshi, who is also an innovator in the cataract surgery, which I have the fortune of meeting him also. And of course, the cyber guru of India and the world, Dr. Pradeep Mohanta sir, who keeps on inspiring the young as well as the senior phaco surgeons all over the world. And for a very long time he was using my pre-chopper. Now he has come with his own design called as Mohanta's pre-chopper, which I'm sure he's going to show us some of the nice surgeries. My guru, Lahane sir, my teacher, Shastra Buddhe sir. So what are the advantages of chopping? When you do a chopping, there is a reduction of the phaco energy delivered, and there is a reduction in the stress to the zonules and the capsular bag, which gives you an opportunity to perform a supracapsular emulsification, and there is a decreased reliance on the red reflex, and there is a greater reliance on the chopper than a phaco tip. And then why pre-chop? It is a technique of mechanical nucleofractice performed under viscoelastic prior to phacoemulsification, and it mechanically divides the nucleus without the use of phaco or a femto laser energy. Advantage of pre-chop is that the phaco energy is drastically reduced, thereby the phaco time, aspiration time and the amount of balanced salt solution used in the antechamber are also reduced, thereby reducing the endothelial damage. And even in the weak zonules, it is very effective, as I am going to show in subsequent videos. In short, it makes the phaco surgery faster, easier and safer. Compared to a femto-assisted cataract surgery, we all know is a very expensive viable option, but may not be within the reach of every ophthalmologist in his lifetime also. It is also restricted by the pupil size and is a problem in a deep-seated eye, and we know now recently that cystoid macular edema is one of the complications of a femto-laser assisted cataract surgery. This is something which has been on the blog, and they are talking a lot about MyLoop, but it also has got a steep learning curve, and PCR is a very known complication encountered. Those who are using, they do agree that PCR is a very known complication. Akahoshi forceps now were tried by many, including myself, but they have a steep learning curve, anterior chamber instability, and there are different pre-choppers for different grades of cataract, making it really confusing. So I have come with a patented design which is sleek and which doesn't have a cross action like a Akahoshi forceps, and I am using in all my cases a side pod instrument which you can use as a Akahoshi ball sustainer, but I am a great fan of Chang's horizontal chopper, but you can also use a ball sustainer. It has a very sharp cutting edge to cut the nucleus of any density. A very diagrammatic representation of what in the diagram 1 how the pre-chop proceeds, and in fourth you will see, and subsequently fourth and fifth and sixth, the entire endonucleus has been divided into two halves, and finally into 4 quadrants. This is one of my PG, this is the diagrammatic perception of what she saw in what I was doing. So we are now talking of rather than working very hard, we are working little more smarter, forgetting the story of the crow uncle long ago when we as a child used to listen to the story. Now let us see the dynamics of Prechop in vitro. I am just marking a capsular axis like thing on the nucleus. This is a ball sustainer, Akahoshi's ball sustainer, popularized nowadays by Neto Rosatelli also. Is a little much longer one. So you have to actually go along the endonucleus surface and then go below the capsule. So this is the only intimidating and frightening step for most of the transition surgeon. This is a Chang chopper which I am again scratching along the endonucleus and going below the rhexis margin and stabilizing. And on in my right hand is this my pre-chopper which I am negotiating through the 2.8 millimeter incision. And once I stabilize the nucleus, I just go a little anterior to the capsular rhexis margin, make it now vertical because I have to negotiate the tunnel. So initially I will be horizontal. Once I am in the antechamber, I will make it vertical. Just try to go into the softer part of the endonucleus, which is the periphery, and then keep on advancing. At the same time, stabilizing my left hand Chang chopper and then producing a crack. This portion, which is the trailing portion of the endonucleus, does require some manipulation in hard cataract to separate the two fragments. And once you rotate them, you are ready now for doing further amount of pre-chops so that the final outcome will be 4 quadrant that can be emulsified with the help of phaco energy. So this was in vitro movement, perception. Now we'll talk of what you can see from the side. So this is right hand, sorry for the minified view. In the right hand my pre-chopper is there. In my left hand is the sustainer or a Chang chopper. So initially you have to go into the tunnel. There is a little bit of for a beginner there may be little struggle because you have already inflated the antechamber. But once you learn that, now this is the way you go it horizontally and then you make it vertically. This was the first video, which was an award-winning video. Enlarge it. Voice is there. And is fraught with complications like wound, endothelial damage, and PCR. Hence, phacosurgeons are shifting from the classical 4-quadrant cracking method to direct chopping techniques. Of late, FLACS, that is the femtolaser assisted cataract surgery, being an extremely expensive option. Therefore, pre-chopping the endonucleus is still a cheap and viable option for us to reduce the collateral damaging potentials of phaco energy. We in this video presents a newly designed pre-chopper well suited for all grades of cataract, especially the harder ones. Pre-chopper goes through 2.8 millimeter incision and the left hand uses a Chang chopper to hook the equator of the endonucleus in all these videos. This is a second video demonstrating the intumescent cataract wherein the surgeon is aspirating a liquid cortex with the help of 26 number needle, capsular rhexis being completed and pre-chopping being attempted. The entire endonucleus now is divided into 2 endonuclei, heminuclei I mean to say, and after rotation again the pre-chopper is dividing a heminuclei into 2 fragments. phacoemulsification is now being carried to empty the capsular bag of the nuclear fragment. In this third video, we are demonstrating a dense nuclear cataract being pre-chopped with the help of this new pre-chopper. The endonucleus being hooked, the pre-chopper is dividing the endonucleus into two halves. This is a viscoelastic dependent technique, and what you need to appreciate is that the fragments which are produced are almost imitating the fragments which are produced by femtolaser. They are very steep, they have a very steep borders. This pre-chopper is also very helpful for dealing with a soft cataract, which at times can produce a cheese wiring when you are using a high vacuum and phaco energy. This elegant pre-chopper is therefore well suited for all varieties of hard as well as soft cataract. Being sleek, the anterior chamber is well maintained, and this is compatible with 2.2 and 2.8 millimeter incision. It doesn't resemble any cross-section forceps like a classical Akahoshi pre-chop forceps. The learning curve is not very steep and is definitely very easy to master. This is the last video of this video presentation where the capsular axis was lost because of the high intralenticular pressure in a intumescent cataract. The end result was a disastrous Argentinian flag sign, and to proceed or not is always in the back of a mind, because we don't want to confront a catastrophe like a nucleus drop during phacoemulsification when the capsular axis is lost. These capsular flap, irregularly torn flaps, are converted into what we can call it as a pseudo capsular axis, and because the pre-chopper is dividing the nucleus, the other pole of the nucleus being hooked by the Chang chopper, the energy is against each other, and therefore this becomes a very safe option for the phacosurgeon to divide the nucleus. So even in loose zonules and where the capsular integrity is not 100%, we can do a phenomenal nice pre-chop. Thank you very much.
No, sir, I have some more to go, sir. So how this can be applied, I am going to show with an example. We have ample time, almost more than 45 minutes have been given to us.
Strategy for nuclear disassembly is the greatest myth in the world of phacoemulsification. I am presenting a consistent single recipe to deal with all forms of cataractous nuclei through the art of pre-chopping. Though Akahoshi pre-chop forceps were introduced as a wonder device, but it had a steep learning curve with a phenomenal anterior chamber instability. Soft cataracts are intimidating and challenging even for a seasoned phacosurgeon because of the poor hold they provide during chopping and the phenomena of cheese wiring. After ensuring optimal rhexis, anterior debris clearance, hydrodissection and adequate nuclear rotation, this sleek and elegant pre-chopper makes the ordeal of nuclear division quite easy and effective. In this white cataract, which is a soft cataract, Chang's horizontal chopper goes through the side port to stabilize the equator of the nucleus, and the pre-chopper with its sharp edges goes through the main 2.8 millimeter incision and dips deep into the endonucleus just anterior to the capsular axis margin. These two instruments moves towards each other to produce a nice pre-chop. Further rotation in pre-chopping produces 4 pie-shaped quadrants to be emulsified at the anterior capsular plane. In a dense cataract, obtaining a pristine cornea day 1 post-op is indeed a challenge. Let's face it valiantly with copious viscoelastic and performing maximum number of Prechop to minimize the effective size of the endonucleus. Of course, you can stabilize the equator of the nucleus either with a Chang's chopper, or you can use an Akahoshi ball sustainer, which I am going to demonstrate in the subsequent videos. Wolf in sheep's clothing is an apt analogy when you confront a leathery cataract hidden in a docile looking white cataract. So let's not panic. Let's apply patience and perseverance to perform the pre-chopping the hard endonucleus into multiple pie-shaped fragments. Once you divide this leathery cataract into multiple quadrants, this becomes a very effective strategy to minimize the endothelial damage. I'm using an Akahoshi ball sustainer as an equatorial stabilizing device in this particular video. Sometimes in order to completely separate the posterior plate, you have to also use dialer-like instruments to mechanically separate them so that all these pie-shaped fragments are not attached to each other. PXF and zonular weakness is never a problem if you have mastered the art of horizontal chop. Here, stretch pupilloplasty is being performed and the Chang's chopper hooks the equator of the nucleus, and a successful pre-chop is thus performed. Once you divide the entire endonucleus into two halves, subsequent emulsification and subsequent chopping becomes quite easy. Conquering a very hard granite cataract requires a lion's heart, copious viscoelastic, and patience is the key. You may notice a little bit of torsional instability in that, but with patience you can overcome once you divide the entire endonucleus into two halves. What is so unique, as is evident in the video clip, is that the fragments which are produced are having a very steep margins, and they are imitating almost the margins which are produced by an femtolaser assisted cataract nuclear disassembly. Plastic have to be used to prevent the interchamber shallowing during these maneuvers. Argentina emulsification at the caution. Perform a controlled hydrodelineation, not doing a nuclear rotation, and preventing interchamber shallowing is the mantra, perfect mantra for successful outcome. Let's simplify this fierce polar bear by performing pre-chopping and dividing the endonucleus into two halves and emulsifying them without any rotation. Really fortunate that there was no pre-existing dehiscence once the cortex was cleared, as is evident. Thank you very much. I am going to skip a video. If time permits, I am going to show this SICS, how this Prechopper can be used in SICS. So I am going now to some clips of 1 minute each. I am using a little bit of chondroitin sulfate to coat the endothelium in a comparatively dense cataract. In soft cataract especially, the quest only is to divide the nucleus into two, because that you can just lift those endonuclei, have divided endonuclei and then emulsifying them. So you don't require 4 quadrant pre-chop, you just have to divide it into two and then subsequently emulsify at the capsular plane. Another soft one I am showing. So after the capsular axis hydrodissection and rotation, which is very important in this pre-chop, then you have to start your pre-chopping. Hydrodelineation ring serves as an definitive guide as to where your horizontal chopper should be. In a comparatively small pupil, stretched pupil plastic can be done either with a Coughlin hook, but I am right now using a Y hook, performing a single sphincterotomy so that my apprehension of catching hold of the iris at 6 o'clock is minimized. That really helps me, and then you can do pre-chopping in a small pupil or exfoliation. Initially it did happen that every time I was doing pre-chopping, I was putting visco, coming out and then performing pre-chop and again putting visco. Now I have learned that pre-chopping can be performed in a single go also without damaging the epithelium, which I am going to demonstrate here. So once you rotate the nucleus, you stabilize the 6 o'clock of the endonucleus and then perform pre-chop, keeping both instruments in the interchamber only. This is pre-chop in the white cataract. regarding the views in small incisions already on the YouTube. If you have leisure, do have a look at the views of the pre-chopper in small incision cataract surgery. Now I invite Dr. Pradeep Mohanta sir, who is going to show his technique of pre-chop, a new pre-chopper which he has designed. Thank you very much.
We need a bigger clap for Dr. Sohail Irfan Khan. He is the man who has introduced pre-chopper in a new way in India. We have seen Dr. Akahoshi using pre-chopper. We tried that, but we could not do it. It has steep learning curve. It works beautifully in Akahoshi's hands, but we could not do it. So, why should we learn pre-chopping? It will be helpful in many surgical situations like soft cataracts, cataracts with weak zonule, 2 to 4 clock hours of zonular dehiscence. I usually use pre-chop in soft cataracts, but Dr. Sohail has shown that it can be used in hard cataract also. In IFIS, intraoperative floppy iris syndrome, we can divide the nucleus under visco in several parts, and after that we can finish off the surgery quickly before the pupil gets small. The difference between Akahoshi's pre-chopper and Dr. Sohail's and Mohanta's pre-chopper is, in Akahoshi's pre-chopper, in soft cataracts, we have seen that Akahoshi doesn't use any sustainer. So he stresses on the zonule and divides the nucleus in soft cataracts. But in our cases, sustainer is used in all cases. So the nucleus is having a support from the other side, 180 degree away. Lateral separation in Akahoshi's pre-chopper is limited, but in our pre-choppers, it is in your hand how much lateral separation you want to do. Learning curve in Akahoshi's pre-chopper is steep. Learning curve in our pre-choppers is maybe 5 to 10 surgeries. Akahoshi's pre-chopper is a costly instrument. Our instruments are economic. Now, the steps in using Dr. Sohail's or Dr. Mohanta's pre-chopper, I have designed a pre-chopper where the pre-chopper is straight. It is not carved like my friend Dr. Sohail's pre-chopper. The front goes straight. It's a very simple design. The sustainer goes through side port first. These steps I am showing in this video. Now see these steps. First the sustainer goes, then the pre-chopper goes. Now the pre-chopper is embedded in the nucleus just in front of the main wound. Then the sustainer hooks the opposite equator, and then the two instruments come to each other. The sustainer comes towards you and the pre-chopper moves towards the other side, and lateral separation is done. See this again. And I want all of you to learn this. This is going to be the next step in cataract surgery, because you don't depend on machine much. Any machine, even Appa Swami's Galaxy Pro Orbit machine will be a good machine. if you can pre-chop the nucleus. So you don't depend on very high-end machine. And now my pre-chopper is straight on. I'll just go, this is a grade 1 nucleus. So you can see this is a posterior subcapsular cataract. Hydrodissection is done. The antechamber is filled up with visco. And now the pre-chopper goes. First the sustainer goes, then the pre-chopper is embedded. The sustainer hooks the equator and you divide the nucleus. And if you try to do this with your handpiece, it is going to take about 4 to 5 minutes. And this is Nato Rosatelli's spin. If you do this, then the pieces will come to you easily and cortical aspiration will be very easy. In soft cataracts, I usually divide the nucleus into 3 pieces, one heminucleus, and one heminucleus is divided into 2 pieces. And now in grade 2 nuclear sclerosis. Friends, welcome to my workplace at The earlier one was grade 1 plus nuclear sclerosis. This is grade 2. Initial steps we forward. Capsulorhexis is done, hydrodissection is done. And now the same way. As the nucleus gets harder, the nucleus will tend to rotate. So you have to keep a balance in your hand. The tip lengths of these instruments, Dr. Sohail's and Dr. mine, the pre-chopper length is 1.6 to 1.8. Mine is 1.8, the pre-chopper tip length. The sustainer tip length in my case is 1.7 millimeter. Once you divide the nucleus into pieces, these are all real-time video clips. Just go and eat up the pieces as if you have cut an idli into 4 pieces and you are just going inside and eating it up. So surgery becomes effortless, but it has a learning curve. You have to learn it through 15 to 20 surgeries, maybe 10. And this is a little harder nucleus. You have seen Dr. Sohail doing in very hard nucleus. I have not tried that in very hard cataracts. This is a grade 3. You can do direct chop in this case, but we can do pre-chop also. Capsulorhexis is done, hydrodissection is done, the antechamber is filled up with visco. And now here goes the pre-chopper. See, the nucleus tends to rotate, so you have to keep a balance in your hand and to divide the nucleus into pieces. So this is a new technique which all of us should learn. It is going to make our surgeries simple. Thank you very much for your patient listening. Now we have inauguration. All of us, please come to hall on.
Sir, I have a question.
Yes, yes, please.
The anterior surface of the chopper, is it sharp?
Anterior leading edge is sharp. The back edge is blunt.
So how hard is it? Can it chop grade 3-4 cataracts at ease?
Yes, I have not tried in very hard cataracts, honestly. I have tried it up to grade 3.
So in grade 3, would you want the retainer to come closer to the chopper, or would you want the chopper to go towards the retainer?
Both instruments come to each other. It hooks the
And sir, in
sustainer
the initial
also.
learning curve, would you want somebody to do it with heel on, so your chamber is maintained while you are trying to do the chopping maneuver, because there's always this tendency to press the posterior lip.
I think that is a good idea. I have not tried with heel on, but it is a good idea. The chamber will be more formed with heel on.
So you have more
So-
control over your hand and
Yes,
more
you
space
can.
to work with.
You get more stable anterior chamber. That is a good
And
idea.
is there a learning curve to going behind into the equatorial region?
Yes, initially you are afraid to do that, those who have not done that. But if you see Dr. Neto Rosatelli's video, he does that with a very long chopper, about 2 millimeter or 2.5 millimeter chopper, ball-tipped chopper. He always goes around the equator. And if we learn that hand movements, it is just in indirect ophthalmoscope. We see the light here at the back of the hand. This finger is pointing this way. So the sustainer also goes this way under the rhexis margin. Then it turns and hooks the equator. Then it goes little deeper. Then you bring it towards you. This is the movement of the left hand.
So have you had any zonal dialysis, any tears,
No,
excess
never,
tears,
never,
anything?
never.
Ever trying it?
Jonular dialysis will never occur, even if the nucleus rotates little bit, this way and that way.
But can you damage the bag as such with your pre-chopper and your retainer?
No, it is designed in such a way that the pre-chopper, in my case, the bottom is also blunt. Only the front is sharp.
Okay,
And the sustainer has a ball tip.
right.
So even if it touches it doesn't touch.
So it's like a blunt chopper. So
It's
it will not
a very
cause any-
blunt chopper. It is.
Right. And you have to feel the nucleus to go and get the area where the epinucleus and the nucleus
No,
joins.
actually, you just go along the surface, go to the equator, and go behind. You don't think about nucleus, epinucleus.
Nothing.
It's nothing that. But if there is if there is a nice hydrodelineation, if you do a nice hydrodelineation, then you can see the you can go between epinucleus and nucleus. But if there is no good hydrodelineation, you just go along the surface, hook the equator, and bring it towards you.
As a beginner, I must say that I should make a note of caution that what your apprehension is true, very correct. If my visibility is not good, and what is recommended is staining in all the cases. Mohantas sir has got a very nice, expensive microscope, but that may not be at the disposal of everybody. So you need to stain the capsule so that the margin will be visible. So what I was trying to impress upon the fact was I am trying to scratch the cortex and the endonucleus and go and make it sure that I go and hook the equator of the nucleus rather than hooking the capsular bag. So as a beginner, I ended up producing 2 dialysis, but I could realize that there is something mischievous happening. Then I have to abort that, and then I have to change my strategy and do the things in the nice way. But this is a possibility. If your visibility is not good, if you are not very, very sure about what you are doing, then you end up producing a dialysis also. There is a possibility that you should take into mind. Thank you very much for attending this course.